High blood pressure silently weakens kidneys every day. High blood pressure doesn't just cause dizziness or fatigue. It can silently weaken your kidneys every day, even if you're taking your medication regularly. The worrying thing is, many people only discover kidney problems when blood pressure becomes increasingly difficult to control. Their bodies feel more tired. They experience mild swelling but think it's due to age. In this video, you will understand why high blood pressure and kidney problems form a dangerous vicious cycle, and how to protect your kidneys starting now. Welcome to the Senior Health Channel. Watch until the end, because the end is the key to long-term health protection. 1. Why does high blood pressure damage the kidneys? The kidneys are one of the hardest working organs in the body. Every day, the kidneys filter hundreds of liters of blood through extremely small capillaries called glomeruli. Imagine this. If the water pressure in the pipes is always too strong, even the best filter will wear out and eventually fail. That's exactly what happens when high blood pressure persists. Increased blood pressure, damage to the glomerular capillaries. Protein begins to leak into the urine. Initially, no pain, no fever, no obvious symptoms. After many years, glomerular sclerosis, decreased filtering capacity, kidneys weaken without warning. This is why high blood pressure is the leading cause of chronic kidney failure. 2. Why do weak kidneys cause high blood pressure? But the story doesn't end there. The kidneys don't just filter blood. The kidneys also regulate salt and water, control blood volume, regulate hormones that directly affect blood pressure. When the kidneys fail, salt is retained, water is retained, blood volume increases. What is the result? Blood pressure is higher, fluctuates more violently, and is more difficult to control. And so, high blood pressure weakens the kidneys. Weak kidneys, in turn, increase blood pressure. A two-way vicious cycle begins to form. 3. Why are older adults particularly susceptible to this vicious cycle? In older adults, blood vessels are less elastic. The number of glomeruli gradually decreases with age, often accompanied by diabetes, dyslipidemia, long-term use of many medications. If blood pressure is not tightly controlled, or medication is not taken regularly, the kidneys will be the first organ to suffer damage. 4. Early warning signs. Why is kidney damage due to high blood pressure so easily overlooked? The most frightening aspect of kidney damage caused by high blood pressure is not its severity, but its insidious progression, causing no pain, no fever, and no clear acute attack. Unlike heart attack, severe chest pain, stroke paralysis, noticeable facial asymmetry, the kidneys fail little by little, slowly enough for you to get used to it. And that's what makes patients complacent for many years. Mild ankle swelling, the first but easily overlooked sign. What's really happening? When the kidneys are healthy, excess water and salt are eliminated. The body maintains fluid balance. When the kidneys begin to be damaged due to high blood pressure, the ability to excrete salt decreases. Water is retained in the body. Excess fluid flows to the lowest areas due to gravity. The ankles and feet are the first places where swelling appears. Why do patients often ignore it? Many people think it's probably just swelling from standing too much. It's normal for old age to have some swelling. It's nothing to worry about if the swelling goes away in the morning. But the truth is, swelling due to kidney problems is usually mild, persistent, and recurring. Initially, it only appears at the end of the day. Then it appears more frequently. Mild but prolonged swelling equals a sign that the kidneys are having problems. Persistent fatigue, not due to age as you think. The nature of fatigue due to weak kidneys. The kidneys don't just filter blood. The kidneys still participate in creating hormones that stimulate bone marrow to produce red blood cells, help the body eliminate metabolic waste. When the kidneys are damaged, toxins accumulate in the blood. The number of red blood cells gradually decreases, anemia. Oxygen reaches tissues and the brain less efficiently. Results: tiredness even without strenuous activity, lethargy all day, not feeling well after waking up. Common misconceptions. Elderly people easily comfort themselves with It's normal to be tired when you're old. Poor sleep. It's just the weather changing. But fatigue due to old age usually improves with rest. Tiredness due to kidney problems. Restoration doesn't help, accompanied by edema, difficult to control blood pressure. Prolonged fatigue for no apparent reason equals a very important early warning sign. Excessive foaming urine. A sign of glomerular leakage. Why does urine foam? In a normal person, the glomeruli retain protein from the blood. Urine is almost foam-free, where the foam dissipates very quickly. When high blood pressure damages the glomeruli, the filtration pores widen. Protein leaks into the urine. Protein reacts with water and air, creating foam. What is the danger? The foam is painless. It's odorless. It doesn't cause discomfort. Many people don't notice it or think it's just urinating forcefully. But excessive foam, slow dissipating foam, frequent occurrence. It is a very early sign of kidney damage. Blood pressure becoming increasingly difficult to stabilize. A sign of a viral cycle begins. What's going on behind the blood pressure numbers? When the kidneys are weak, poor ability to regulate salt and water, disruption of the hormone system controlling blood pressure, more prone to constriction. Results: blood pressure high in the morning, low in the afternoon, stable today, rising again tomorrow. Previously effective medication, now less effective. A very dangerous mistake. Many people increase their medication dosage on their own, or change medication based on feeling, while difficult to control blood pressure may be a consequence of damaged kidneys. At this point, not only treating high blood pressure, but kidney function must be reassessed. The kidneys are not silent, you just haven't understood their language yet. Signs: mild edema, persistent fatigue, foamy urine, difficulty stabilizing blood pressure. This is not normal for old age. It could be the earliest warning signs from the kidneys before damage becomes irreversible. Early detection can slow down the disease, can avoid major interventions, can maintain a good quality of life for many years. 5 practical solutions. Why is good blood pressure not necessarily safe? Many people are misunderstanding a dangerous thing. Just measuring 130 out of 80 is enough. The mistake is, blood pressure isn't a single photograph, but a film that lasts all day. The kidneys, heart, and brain aren't damaged by a single high number for 1 minute, but by unstable pressure that fluctuates repeatedly every day. Physiologically, what do the kidneys fear most? It's not transient high blood pressure, but rather blood pressure fluctuating erratically, high in the morning, low in the evening, stable today, rising again tomorrow. These fluctuations cause the glomerular capillaries to constrict and dilate continuously, the blood vessel walls to harden rapidly, the glomeruli to become tired and damaged much faster than with a steady increase. Therefore, a person with an average blood pressure of 135, but with strong fluctuations, is in greater danger than someone who maintains a stable level of 140. What does stable minimal fluctuation, consistent mean? What does stable blood pressure mean? No sudden spikes, no abnormal drops, maintains around a safe target level. Stable equals no pressure shock to the kidneys. What does minimal fluctuation mean? The difference between measurements throughout the day is not too large. No situations like morning 160, evening 120, today 125, tomorrow 155. The more fluctuations, the faster the glomeruli deteriorate. What does consistent daily mean? Taking medication on time, eating a stable diet, having a clear circadian rhythm. The kidneys are very afraid of irregularities. 3 essential things to do. Thing 1. Measure blood pressure regularly, at the same time. Why is measuring, sometimes remembering, sometimes forgetting meaningless? Blood pressure changes according to biological clock, is affected by diet, exercise, and emotions. If you measure in the morning today and in the evening tomorrow, you are comparing 2 completely different times. What the doctor needs is not a nice number, but a trend. Proper measurement to protect your kidneys. Measure: morning, 30 minutes after waking up. Evening, before going to sleep, sit and rest for 5 minutes. Record the numbers. After only 7 to 14 days, you will see whether your blood pressure is stable or not, whether there are dangerous fluctuations or not. Thing 2. Do not stop medication when you feel good. The most common mistake. Many people think, my blood pressure is stable, I'm sure I'll be cured. Taking it for a long time might harm my liver and kidneys. I feel good today, I can stop taking it. The reality. You feel good because the medication is working. Abruptly stopping medication. Blood pressure spikes again. Blood vessels go into shock. The glomeruli suffer more severe damage than before. This is especially dangerous for people who already have early kidney damage, diabetes, age over 55. Biologically, blood pressure medication maintains safe glomerular filtration. Pressure protects the renal blood vessel walls. Stopping medication equals removing the kidney's protective layer. Step 3. Notify your doctor if there is a significant difference between morning and evening blood pressure. This is a very often overlooked sign. Many people only see a morning reading of 130 is fine, but they ignore the night reading goes up to 155 or drops to 105. A large difference indicates the blood pressure regulation system is malfunctioning. This could be related to kidney problems, salt and water imbalances, endocrine disorders. This is the stage where early intervention can still save the kidneys significantly. Proper blood pressure control isn't about chasing a perfect number. Instead, it's about stability, minimal fluctuations, maintaining regularity every day. Achieving these 3 things, the kidneys can breathe, the glomeruli are less damaged, significantly reducing the risk of kidney failure due to high blood pressure. Treating high blood pressure is linked to protecting the kidneys. Why can't they be separated? Many people think simply, just lower the blood pressure and that's it. This is a very dangerous misunderstanding. In reality, the kidneys are the highest pressure blood filters in the body. When high blood pressure persists, blood rushes into the glomeruli. Tiny blood vessels in the kidneys become strained, torn, and fibrotic, leading to protein leakage and impaired filtration function. Therefore, high blood pressure not only damages the heart, but also erodes the kidneys day by day. Not all blood pressure medications are the same. Some groups of blood pressure medications are preferred by doctors when there is a risk of kidney damage because they offer additional benefits. Reducing pressure inside the glomeruli, reducing proteinuria, protein in the urine, slowing down the process of renal tissue fibrosis, helping to preserve kidney function long-term. In other words, both lowering blood pressure and preserving healthy kidneys. The core principle to remember: treating blood pressure is not just about looking good, but about protecting target organs, especially the kidneys. Small habits to break the vicious cycle of high blood pressure and kidney failure. Habit 1. Eat less salt every day. No need to be overly strict. Salt causes water retention in the body, increased blood volume, making blood pressure difficult to control. Reducing salt helps blood pressure to be more stable. Blood pressure medication to work better. The kidneys don't have to filter in a high-pressure environment. Just taste a little less salt. Reduce fish sauce, pickled foods, and processed foods. Less salt equals less burden on the kidneys. Habit 2. Drink water regularly. Don't rush. Many older people drink a lot of water during the day. Drink less. Drink a large amount at once in the evening. This causes the kidneys to work irregularly, easily accumulate waste products, blood pressure to fluctuate more. Drinking water regularly helps kidneys filter more stably, reduce the risk of toxin buildup, support better blood pressure control. Simple principle: drink in small amounts. Drink evenly, according to your reasonable thirst level. Habit 3. Monitor kidney signs. Don't just look at blood pressure. Blood pressure may be temporarily stable, but the kidneys are still silently being damaged. Attention: mild swelling of the legs and ankles, foamy urine that takes a long time to dissipate, persistent fatigue for no apparent reason, These are not normal signs of aging. They could be signs that your kidneys are crying out for help. Early detection equals more options. Late detection equals passive treatment. High blood pressure and kidney problems form a dangerous vicious cycle. High blood pressure damages the kidneys. Weak kidneys make blood pressure even harder to control. Only with the right treatment, a healthy lifestyle, and early monitoring can you break this cycle. High blood pressure doesn't cause immediate pain. Weak kidneys don't make loud noises either. But when these two problems are connected, the consequences are often slow, deep, and very difficult to reverse. The good news is, with proper blood pressure control and early adjustments to diet and lifestyle, you can completely slow down kidney damage and maintain a long-term quality of life. If this video was helpful, please subscribe to the channel and share it with loved ones who have high blood pressure, because sometimes a timely video can help them avoid difficult choices later. Thank you for watching. Wishing you good health and the ability to proactively protect your health every day.